your bread and butter stuff, trust me, especially when it comes to identifying colour of blood, knowing which type of bleed it is. Okay? So yeah, catastrophic bleed. What's number 3? Good on you. An airway. Now, what do I mean for those again, please, who are not in my class? Because I need to see what everybody knows and what they don't know. What does an airway mean? If I ask you, does somebody have an airway, what does that mean? Say again? Somewhere to breathe from, okay. And what's my concern? Clear. Clear from what? A blockage, obstruction. Is that right? Absolutely. You're all right. Fair play. But what's my biggest concern? What's the biggest problem? Or what's the biggest obstruction that happens? Your tongue. Absolutely. Good on you. There's a wise tale that you can swallow your own tongue. If you swallow your tongue, lads, you deserve a prize. Alright? Because your tongue isn't just what's in your mouth, it goes all the way down here as well. It's a large muscle. I did an exercise in my class. Did you do the exercise with the breathe and put the head down? No, I care. Do you do it, Carol? No. I'm from the staff has, I'm sorry. Right, for those who haven't done it, okay, what I want everybody to do right now is just to sit up for a second. Because this is the easiest way to explain this to people. I know some have done this and some haven't. For those who haven't and those who have, I suppose, breathe in through your mouth and out through your nose for a minute. Okay? In through the mouth and out through the nose. The next thing I want you to do is put your chin on your chest the whole way down. The whole way down. You shouldn't be able to see me, okay? And breathe in through your mouth and out through your nose again. Okay, heads up. You just felt your airway being occluded with your own tongue there. I asked my own class, and most people think, you know, your trachea, there's a bend, there's a move, is your neck for? That's your tongue. By you forcing your head down like that, you actually physically force your tongue back into your airway. But because you're cognitive, you can control that muscle and you pull it forward to allow yourself to breathe. But in anybody who's unresponsive, lying on their back, that tongue is like any other muscle in the body. It goes floppy and flaccid, falls into the airway, cuts off their breathing, and that's what most people die from when they're unresponsive, is a flaccid tongue, believe it or not. One of the biggest killers of obstruction airway is your tongue, for that reason. Okay? So airway, is it obstructed with your tongue? Absolutely. Okay, what's next? Say again? Okay. Yeah, okay, I'll get to that in a minute. After that, breathing. Breathing. Okay. Okay, breathing. How many breaths per minute for an adult? 12 to 20. Good on this, absolutely. Those who don't know that, write that down, because that's something you definitely need to know. 12 to 20 breaths in a minute is what an adult should be taking every minute. Okay? How do you assess somebody's breathing?
Looking at their chest.
Good. Looking at their chest is one, yeah? What else?
And the hand on their back.
Say again?
Hand on their back.
You could put your hand on their back if you want to, yeah.
Listen.
Listen.
Yeah, it's heavy.
Okay. Typically we're looking for chest rise. And another way of doing it is that if you're going to count someone's breaths, do you think you should tell them you're counting their breaths? Why not? Just slow it down, believe it or not. Yeah, slow it down. So pretend, what I do is I pretend I'm taking their pulse and grab their wrist. Hey, yeah, my name's Pete, I'm a first aid, yada 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 yada. So I've got to take their pulse real quick and then put my hands into their wrist. But I'm actually looking at the chest to see if the chest rise. And I'm counting it down for 30 seconds and multiplying it with 2. Giving them the breaths in a minute. Okay? That's a good way of doing it. Or if you want to be sneaky through the corner of your eye, kind of watch someone's breathing in and out, okay? But sometimes people get a little off foot for that, they're kind of like, what are you looking at, you creep? Alright? So, picking up the radial is probably a better way of checking for somebody's breaths. Now, with 12 to 20, we know that's the breaths in a minute. What other factors are we looking for when it comes to breathing?
It's fast.
Good, if it's fast. What else? Shallow, noisy, wheezy, absolutely, yeah. What else? Look at you showing off. Difficulty in breathing, absolutely, good. So we're looking for 2 things. We're looking for a thing called shortness of breath and a thing called difficulty in breathing. SOB is for shortness of breathing, nothing else. Alright. Shortness of breath very simply is, has anybody ever seen anybody have a panic attack? Yeah? That's what we're talking about when someone becomes short of breath. But one of the most common signs of telling somebody short of breath is that they can't complete a full sentence. Okay? Because not everybody goes, not everybody pants. So it mightn't be that obvious, especially with masks on. But if they can't complete a full sentence, strong indicator they're short of breath. Difficulty in breathing, very simple. The wheezy, the noisy, the agonal, all that kind of stuff is difficulty in breathing because it's difficult for them to breathe. It gets accompanied typically by them being pale, sweaty, blue tinging around the lips. You can find that they'll purse where their lips get pushed out like they're about to kiss you, but they're actually sucking in air. Alright, so don't take that as a come on. Absolutely. Nasal flaring is another one. You'll find that nasal passages will open really wide because they're trying to suck air in as much as they can. You'll see it here getting sucked in as well. I'm sure some of the guys know I did, Kieran did, we showed us the asthma video of that little fella, or 15-year-old fella. You didn't show it, no. But Kieran, you showed it. Yeah, I showed it as well. Up in respiratory distress, where you can see all in here getting sucked in. How many lungs have you got? 2. What's the large muscle at the base of your lungs? Diaphragm. If your diaphragm is under any stress, like any muscle, what happens to the diaphragm? Gets worn out. So what happens next is the stomach starts sucking in, the muscles here sucking in and pushing the diaphragm up to push your lungs up to get air in and out. So you'll see the stomach getting sucked in as well, difficulty in breathing. These are all big whopper signs of somebody in distress. Now if you walk into a room and find somebody like that, very simple, a couple of questions we need to ask. Number 1, any respiratory conditions? Yes or no? If it's no, next question is going to be any loss of taste of smell, any fever, okay, any cough, are you bringing anything up or is it a dry cough? These are questions we're going to ask next because what are we looking for? COVID, absolutely. We didn't used to teach this as part of this, but now because of COVID it's quite important for you to know this stuff. Okay, what's next after breathing? Circulation, brilliant. How do you know by looking at somebody that they've got good circulation or not? Skin colour, brilliant. Good. Next thing is we check for pulse. What's the pulse for an adult? 60 to 100 beats per minute. If you don't know that, write that down. 60 to 100 beats per minute is what the average heart rate should be. We need to find out is it regular or irregular. What's the temperature? What's the human temperature? 37 degrees Celsius. Need to know that, write that down as well. 37 degrees Celsius is the temperature of the human body. How do we check for a temperature without a thermometer? Yeah, it should be the same temperature as you. So how do we check it? Back of your hand, absolutely. And that's the logic behind it. It's the one number that we're all supposed to be the same. So the logic is if you feel hot, they're hot, they're cold, they're cold. Alright? Apart from that then using like in-ear thermometers and stuff, okay? How do I tell you is we check for blood pressure? So, fingers, no, that's not a good indication of blood pressure. That's cap refill. Cap refill will only tell you about blood going out to the extremities. The reason why it's not a good indicator is, anyone ever heard of a condition called Raynaud's? Yes, no, maybe so. Raynaud's is a condition of poor circulation where you find people with purple hands and stuff. People that smoke 40 million cigarettes a day. People with arthritis, which you're definitely going to see in care homes, with the big swollen knuckles. Their cap refill is going to be terrible. But does that mean they've got bad blood pressure? No, probably better blood pressure than you would. One of those things. The only definitive way to look for a blood pressure without a cuff is by making sure they have a radial pulse. If they've got a radial pulse, blood pressure is fine. Okay? What's number 6? Disability. Good. A disability is broken into what headings? A, V, P and U. What do they stand for? What's A? What's V? Voice. P. Pain. U. Brilliant. So tell me, what does alert mean? How do you know if somebody's alert or not? Okay. Very simple. Somebody walks into this room right now, what are you all going to do? You're all going to turn and look. That's the first gauge of seeing if people are alert, especially with kids. Okay? Next thing is we're going to ask them questions to see if they understand what I'm asking them. What type of questions am I going to ask them? Huh? Okay, so if I ask them their name and age, you told me your name is John, you're 46. What are you going to be different with? What day is it? That I know the answer to, don't I?
What year?
What year is it? Absolutely. Where are we right now? Absolutely. Who's the President of Ireland? Stuff like that I know the answer to. If they answer me correctly, they're alert. Okay? If they answer me and tell me that it's 1956 and they're sitting in the White House and they're President Roosevelt, I'm just going to say, thanks very much, write down what they say. I don't laugh, I don't snigger, I don't try and correct them because they think they've answered me correctly. So they're verbally responding with voice, but it's not making sense. There's something wrong here, cognitive wrong. Another form of voice would be in your unresponsive patient. If someone's unresponsive on the ground, you can shout at them to see if they're alert. You can shake them a little bit, nothing. Next thing you can do is put your hand into their hand, tell them to squeeze their hand, or squeeze your hand if they hear you. If they squeeze your hand, that means that they're still responding to voice. If that doesn't happen, we then have to apply pain. How are you supposed to apply pain to a patient? Pinch the back of the hand and twist it. Absolutely. One of three things will happen. They'll either withdraw their hand, okay, the face will be in some pain, or they'll try and hit you a dig. If none of those three happen, they're P. They're responding to pain. So remember that. Anybody ever has to apply pain to a patient, no matter what they pinch, push, rub, whatever, they are P on the APCU scale. Pain means P. Everybody understand that, yeah? Good.